hit my record button real quick.
I see it now recording. Perfect.
Perfect. And I'm going to now go ahead and flip us back over to this. And let me know if you can see the first slide of the slide deck, which you should see about now.
Yes, sir. I do see that. So, Kevin, with permission, I'm going to go ahead and get started.
Let's do it.
Welcome, everyone, to our webinar on using AR/VR in schools. Today, we're focusing on the MedCognition PerSim system, which is specifically designed for training with EMS and pre-hospital services. I do have with me today Dr. Kevin King. We're both going to introduce ourselves, but we're going to be seeing today. When I was introduced to this product, I knew this was going to change how we can train in pre-hospital in emergency medicine. And so I'm really excited for you to see this. It is such a cost-effective way. And please, because we have requested through Dr. King, with our being a new partner with MedCognition, we are going to give you some special pricing at the end. And you're not going to believe what they're willing to do for us. So stick around, and we will have that for you at the end of our 25, 30-minute webinar. So, Kevin, if you'll advance that, I want to just go over a few housekeeping. If everyone will just remain, that typically cuts out all the background noise. And we're going to use the chat feature if you have a question. So if you want to ask something, just click on chat, submit it, and we will get to those in our Q&A at the end. But you can always submit those throughout the demonstration. So please do that, and if you'll just stay muted, it'll make it a nice experience for everyone. All right, Kevin, next. Today, what we're going to be doing is I'm just going to give you a brief overview of JourneyED and what we've been doing for the past 25 years. We'll go immediately into PerSim and then finish up with our Q&A. All right, thank you, Kevin. Next. All right, just a little bit about JourneyED. We are located in Allen, Texas. We've been in business since 1990, and we are a national company. We are one of the only Adobe, Microsoft Platinum partners. We do a lot of software, but we also started a brand new augmented and virtual reality department a year ago. That is my background as an educator, as an administrator, which I'll tell you more about that. But we started an augmented and virtual reality department because we truly believe this area is just going to continue to grow, just like an iPad has over the last 10 years. So we wanted to be able to provide schools, colleges, universities with the latest resources that work, and that's what we're doing today. Our national, nice part about Journey, not all, are on all of those contracts and to offer you that discounted pricing. Thank you, Kevin. If you'll go forward. Just to tell you a little bit about me, and then I'll turn it over to Kevin. My name is Joe Hutchison. I am from Georgia. I spent all my career as a teacher, as an assistant principal, as a principal, before moving into professional development, specifically with augmented and virtual reality. So when you ask questions to me, I'm answering teacher to teacher. And that is my passion, is to go in, do trainings, and provide the support. But that's my background, being an educator. This is my 29th year, and look forward to working with each and all of you as well. So Kevin, tell us about yourself.
Hi, everybody. Whoops, I advanced a slide prematurely. Sorry about that. Hi, everybody. My name is Kevin King. I am a practicing emergency medicine physician and a career-long educator. Started out my emergency medicine career in the Army, training medics, deploying to Iraq, running emergency departments, teaching medical students, teaching residents, lifelong educator, and a little while back really came to the realization that the tools we had to teach clinical assessment and critical thinking skills were really pretty wanting. And so what I'd like to do now is go into a quick overview about our product at MedCognition called PerSim. So PerSim is the first augmented reality medical patient simulator available on the market today. And the focus of PerSim is to help teach critical decision-making skills, being able to recognize when a patient is in trouble and really start to understand what that looks like and how folks react. We created this, a group of clinical educators, myself and 2 other clinicians who are also career-long educators, teamed with a leading expert on augmented reality here in San Antonio to create what we feel is a cutting-edge simulator that's really designed to meet your needs. It's affordable. It's far less expensive than mechanical simulators like Laerdal or CAE. It's portable. The whole thing weighs about 30 pounds, fits inside a Pelican case. We ship it all over the country all the time. And as you're going to see, it's really pretty darn realistic. Just briefly, let me give you an overview on how it works. We use the Microsoft HoloLens, which is an augmented reality device, some tablets to provide a controller for instructors as well as a physiologic monitor. We tie it all together using a Wi-Fi network, and we can control animations, these very realistic looking animations of what patients actually look like when they're having clinical problems. And one of the really cool things about this technology is we can actually wrap that animation over a mannequin. You don't have to have a mannequin, but if you've got one you want to use, like a Rescue Randy, because you want to have your students dragging around, 100-kilogram Rescue Randy, we can wrap that animation around the mannequin. And this is what it looks like. It all fits inside a Pelican case, 32 pounds, and it takes literally about 5 minutes to set it up once you get out of your training location. But the essential skills that we feel are supported by PerSim are those all-important affective and cognitive learning skills that often are neglected by plastic simulators. Your students will likely feel more involved with the simulation because of the realism involved. And because the realism involved allows you, the instructor, to not have to paint the picture. You don't have to tell the student that your patient is seizing or your patient is diaphoretic. The student can actually see it, and we can represent different degrees of diaphoresis, for instance, and you're going to see that here in a second. So we really work on those clinical assessment skills. When we talk about the EMT and nursing education, the bottom line is these are common requirements in all of the curricula for this. We got to do general impression stuff, AVPU, take the history, examine body systems, get those vital signs, and then also we're able to alter the patient's condition, the simulated patient's condition, as the student progresses through the scenario to provide that positive or negative feedback. So for instance, in a respiratory distress patient, if they say, I want to put a paper bag over the patient's head, we can make the patient with more respiratory distress. I realize it's a kind of a strong example, but the point is we can really vary what they look like. And you're able to customize student scenarios as needed on the fly. So what I'd like to do now, there's going to be a little bit of a break here in the video while I switch to a different view. I want to show you what this looks like and just how powerful this is. So I've got a demo here, and it's going to start. And what you're going to see is just my hand, and this is the view from the HoloLens. And what I'm doing now is I'm placing some markers on the bed to tell the computer, the HoloLens, where to place the simulation. I'm backing up. I'm going to say the word load. And there's the simulation placed right where I want it. Notice how it conforms to the curve in the bed, so we can sit the patient all the way up to 90 degrees, put him in a semi-Fowler position or whatever. And here he's kind of in mild respiratory distress, but I can vary what he looks like just by pushing the button on the tablet that I'm holding in my hand. And I'll show you that tablet here in a few minutes. But we're going to get a little bit closer to him, and you might be able to see a little bit of diaphoresis on that forehead, just a little bit on the forehead. But now what I've done is I've pushed that severe respiratory distress, and now we can see he's gotten a little bit more cyanotic, clearly working hard. We've got that accessory muscle use, and you can see that diaphoresis is now down on his chest, and it's all over his face. And so just by pushing a button, not having to say a word, we can really change what the patient looks like, what the student is seeing in the clinical condition. In the background here, you see our physiologic monitor that's tied in, so the vital signs can be programmed to reflect what you see through the HoloLens. Okay, and then we can do some things, some unexpected things, like, okay, your patient's doing okay, but now what's this, right? And so I haven't said a word. Those of you who've done this for a little while realize that this patient's now having a seizure. So I didn't have to say anything to the student. I didn't have to paint the picture. I just hit a button and the patient goes into a seizure. And then after he's been seizing for a while, the student selects some meds, does the right thing. We can hit another button and the seizure will slow down here and stop in a very natural looking way. Now, what you may not be able to see too well here is now that the patient's in agonal respirations, that vital sign monitor, which I didn't realize was going to show up so small in this video, is actually showing a status 60%. So now we've gone from respiratory distress to seizure, stop the seizure, but now we're in agonal respirations. Complex decision making at its very best. All right, pardon me for just a second while I get us onto a new screen. All right, so I want to now show you a USB a capture from our tablet. So give me just a second to get the tablet opened here. And so what we have here is our instructor our instructor software, and this is contained on a Galaxy tablet, just about the same size as a standard iPad. And we can load a scenario. So the scenario I'm going to load for you is the Webcast demo that I just showed you. And as you see, this is configured like a storyboard. So from left to right are different things. I had mild, moderate, and severe respiratory distress. And to jump between them, I just hit a button. So I can paint a picture like, hey, Joe, your patient is complaining of shortness of breath. And while you're talking to the patient, you're taking the history, we can just hit a button, make it a little bit worse. And then Joe says something like, well, I don't know really what to do with this patient. I think I'm going to give him some aspirin and see how things go. So as we know, aspirin in an asthmatic can be problematic. So now instead of saying, oops, you messed up, Joe, and now your patient's really having a lot of trouble breathing, I can just hit that button and the patient state changes. And we can tie vital signs to these changes to make this very dynamic and easy on the instructor. And then like we had before, we had the seizure. And then to stop the seizure, to activate the seizure, you just hit the button like I just did. And then to stop the seizure, we just hit the agonal respiration button. Pretty slick. You may wonder, how do we build scenarios? So now what I'm doing is I'm going to open up the editor window on our tablet. Okay. And this is the respiratory distress library of different respiratory distress animations. We also have stroke, chest pain, abdominal pain. We also have a baby. All right, so I'm just going to go ahead and take this, and all you do is you select what you're looking for, moderate respiratory distress, and you drag it onto the storyboard, and you place it in any order you want. And ultimately, you place it in an order that makes sense for you. And then you can tap on a particular state, see how it lights up in yellow, and then across the bottom, we can associate different things with it, like auscultation sounds. We can program lung sounds and heart sounds that the student can listen to by saying auscultate heart or auscultate lungs. We can change what the patient looks like, cyanotic, diaphoretic, flushing, seatbelt sign, drooling, that sort of thing. And then we can also associate vital signs. So here are all the vital signs, and in fact, we have a full ACLS rhythm library set, so you can do megacodes with this. We can start out with chest pain, the patient gets worse, then he goes into full arrest, and we can do multiple rounds of ACLS. Do we shock, do we not shock, that sort of thing. And then the rest of these options have to do with how it's displayed. Now, one thing I'd like to show you, this is a feature, we've got some really cool stuff coming down the pipe. I want to show you a very early test version of our software. This looks a little different than what you were just looking at. This little thing with the exclamation points on the right-hand side is just a debugging thing that our programmer has. But one thing that we're developing is this idea of a checklist. And so you'll be able to, while the student is participating, you'll be able to go to a checklist that you can upload, that you can customize, and then while the student is going through their scenario, you can check off what they've done correctly or perhaps what they didn't do correctly. And then this data, once we stop the scenario, is exportable as a spreadsheet back to your computer with the student information attached to it. Okay. One last thing I'd like to show you real quick. I just got to start it up on my system here. There it is. This is just a quick preview of our monitor system. So we have an integrated monitor, physiologic monitor. It's based on a life pack. And this is just a demonstration loop. I have the sound turned off because it gets a little annoying after a while. But as you see, we've got heart rate, we've got SpO2, we've got a respiratory rate. We're in the process of developing a quantitative capnography with various waveforms showing respiratory insufficiency. Of course, you see the blood pressure and temperature. And then, as you can tell, the right side here is our defibrillator panel, which is fully usable, and then we can even shock the patient. And when you push that shock button, the simulation actually responds to that, and there's a little hop like you would see in a real patient. We have plans to develop an AED, so you can use this to train BLS providers on how to use an AED. So that is our monitor system. One thing that I forgot to mention earlier is that we on the HoloLens, you can actually stream the point of view camera like we did directly to any device with an HDMI port. So to a television or to a movie projector or to a screen projector or whatever. And that allows students who are not participating in the simulation session to observe what their colleagues are doing. And I like to leverage the evaluate your colleagues and learn from that evaluative experience. So that allows you to keep everybody engaged and involved as things move forward. So I'm going to shift us back to our slide presentation real quick and restart it. Here we go. Okay, so that concludes our demonstration. One thing I want to share with you, this is super cool, we're very excited, breaking news from MedCognition. MedCognition, in collaboration with a local company here in San Antonio, was awarded a large contract by the U.S. Army to develop a full trauma capability for the military to do tactical combat casualty care training, or basically combat advanced first aid. So we're really excited about this. And so I just showed you that integrated grading capability that we were talking about, that checklist. That's one of the things that we're developing for the Army. We're going to develop a complete trauma set. This is traumatic amputations, head injuries, facial injuries, blast lung, penetrating wounds, contusions, fractures, the works. So we're going to have a very robust trauma set when we're done. And not only are we going to have the male trauma guy, but we're also going to be developing a woman who is also going to have those same traumatic injuries and also some of those medical things that we've already done. So by the time we're done with this, we'll have a female as well. And then I saw that we had a question about multiple patients. We will be building a multiple patient capability that will allow you to display up to 4 patients in a given scenario in one space at a time, allowing you to train that all-important mass casualty capability. And we're going to talk about that here, and we're going to answer some of the rest of these questions here in a bit. But what I'm going to do now is turn things back over to Joe.
Okay. Here we go. Perfect. I appreciate Kevin giving me controls. I did want to move on forward with what the special offer that I mentioned at the beginning. And we just asked to celebrate our new partnership. You know, could we offer some special pricing for today's viewers, participants? And so that's what we have worked out. Just so you're aware, Kevin, I'm not sure is the mannequin, the software, the tablets, the full system is $2,009. Right now, we're going to do it for $9,909 full system, and the only catch is we want to get this in by June the 15th. So if you're interested now in that pricing, we are going to do a limited offer between now and June the 15th. If we get a purchase order, the full everything, and I know that sounds too good to be true, but that does include everything that Kevin's. They're to the now for the. So that's the offer that we have right now. Very affordable. By our local school that have this reaction as well. I just want to be very clear. Yes, that includes the HoloLens. Yes, that includes the software Kevin's talked about. Yes, it includes the tablets. This is not we're holding back something and then try to upsell you later. We just want to get knowledge running now. Kevin, are you ready to Q&A?
You bet.
Right. Well, I'm just going to start it up and I'll just let you answer. I think you've already done the first one. Does the system support multiple pins? And I think you've given that answer. Yes?
Yes, I'm sorry.
Okay. Next one. This seems like a lot of talking, but not actual hands-on.
This is a great question. So one of the things that we want to focus on with this product is kind of twofold. I think the most important thing in terms of hands-on skills is not only the skill itself, but the when and the why to actually perform that skill. When should we be doing it? Should we be doing it at all? And that's something that we're really focused on in our training. As I mentioned during the presentation, we do support the overlay of the animation onto a mannequin, such as a procedure mannequin. So you can use your existing procedure technology, mannequins with ID arms or chest tube trainers or that sort of thing, to where you can actually overlay the injury patterns or the illness patterns, and the student can do the skill on the mannequin. The other piece that we're working on, still kind of building it out and testing it, is the ability for the student to use voice commands to control interventions like medication administration, oxygen administration, application of different things and that sort of thing. So we're working on making it a bit more interactive, but at the end, for true like hands-on skills, we do support that overlay on the training mannequins.
Okay. Next question. We teach EMT and paramedics here also. So a good point would be, does this support multiple patients, or would separate systems need to be purchased?
So today we only support one patient at a time on the simulator, but as I mentioned with our Army development contract, we will have a multi-patient capability towards the end of that period, which is about a little less than a year from now. So we'll start testing that multi-patient capability probably the early part of next year. But one thing that I want to make sure that I'm addressing the question also is, we support multiple students on the same simulation by offering additional HoloLenses for purchase. So as we mentioned before, the base system includes one HoloLens, but institutions can purchase additional HoloLenses to allow 2 or 3 or even 4 participants in a given simulation scenario. The majority of our existing customers have selected 2 HoloLenses on a given system, and that allows for team-based training.
All right, Kevin, just so we don't run out of time, I'm moving on. Another part, same question. Also, we work in partners. Person see that would a partner work into this device. I just touched on that. Anything to add?
Nope.
Okay. Next question. Does the system allow you to move the patient, i.e. rollover?
So when you go to move the patient, if you're using something like a mannequin, every time you move that mannequin that you're using as your reference training tool, like a Rescue Randy, you do have to place the animation back on that mannequin. That process literally takes 10 seconds. So right now we can't dynamically track that mannequin as we move it in space. That's based on how the HoloLens works. But it's not a big deal. It's very easy to move the simulation from place to place.
Okay, thank you. Are you able to broadcast signal out to external monitor so bystanders can watch?
Yes, we can, just like we just did with you guys. If you're familiar with Chromecast, the HoloLens works on a system called Miracasting, which is very, very similar to the Chromecast device. And in fact, I'm trying to think, the HoloLens does work with Chromecast, I believe, but the Miracast devices are, I think they're about $30 or $40 a piece, and they plug right into the HDMI port of whatever device you want it to cast to.
All right, Kevin, I'm sorry, I should have continued because this ties right into that. Either through participants' eyes or better yet, tied to a... Nothing further to...
It seems like you may be asking if we can integrate the graphics, if you have like a third-party camera, and integrate the graphics into that video feed from like an eye in the sky camera. Currently, the Microsoft technology doesn't support that. That is something we're interested in doing, but it's not in our immediate plans.
Okay. Greenville Technical College just purchased iSimulate reality systems and LifePak 15s. Does PerSim integrate with any of these?
No, it doesn't, but our monitor system that we provide with the system, it's included in the price, replicates a great deal of the functionality of the iSimulate systems.
Okay. What about upgrades and warranty?
The upgrades and warranties, so I'll address warranties first. The warranty or the manufacturer warranties on the hardware for Microsoft and Samsung, that's a year. We've had our oldest HoloLens is about 3.5 years old, and it's still going strong. These are designed to be devices that are used in industrial settings like machine shops and factories. So they're designed to be pretty durable. They're built essentially to the same kind of build quality of like a high-end laptop. As far as the upgrades go, we will be introducing an upgrade program for the scenarios and the animations that are available. As we develop that content, we'll be providing that information to you. But our intent is to keep the prices as low as possible.
Will the checklist be part of this or come? Whoops, my screen just jumped. Will the checklist be part of this or come in an upgrade later so it could overlay with the meta?
So that's two questions. The checklist is not part of this quite yet because it's not ready. We haven't decided exactly how we want to put that out to everybody, but it's coming. It's just we're still developing it. So I wanted to give you a sneak peek. The answer about the Mediman is yes, it will overlay on the Mediman, but because the Mediman looks like a Russian swimmer and so bulky and heavy, it looks a little funny because you can kind of see the mannequin on the outside, but it will work with it.
Do we have and CardioVert and 12?
So we do have pacing. We do have cardioversion. 12 lead is a capability that we're working on. What we're likely to do is allow you to upload your own 12 leads into the system and just display it when the student asks for a 12 lead EKG. That's something that's on our short-term development list.
Okay. Last question. Do students struggle to perform any skills in the headset or the HoloLens?
So I haven't gotten any specific information on that. What I'm going to do is send Joe a link to a testimonial by one of our customers. His name is Neil Coker. He talks a lot about how they've been using it. I've worn the HoloLens a lot. It's very easy, actually, to look underneath the HoloLens at what you're trying to do. So we haven't heard a lot of complaints about this, but it's not something we specifically sought information on either.
Seeing no more questions, our time is coming to an end. I want to let everybody know that we have recorded this. I will send it out. We are available for any further questions. Please just reach out. Yes, we are available for on-site demonstrations when we get to that point. So please, we just want to serve your needs. So since there are no other questions,
Joe, there's one other question.
Yep. If we have to purchase this, can we get a sole source letter? I can answer that one because I just did it this morning. Yes, we have that letter that we can provide to you, so that is not a problem. But we just want to provide you any support that you need and just trust that you'll let us know how we can do that. Kevin, do you want to add before I dismiss the group?
I certainly don't, other than I just want to thank everybody for attending today and understand that a big part of why me and my colleagues got involved in doing this is we understand what pre-hospital does and the challenges you face. And what we really want to make sure is that we get the best possible training tools out to you guys so you can do the best possible work and save lives. Because I know that pre-hospital care makes all the difference in patient outcomes. So thank you for what you do. And let me know if there's anything we can do to help you.
Absolutely. I was with her recently, and we called one, and I appreciate things that you group is provided because of the care she received. So thank you very much. Thank you very much.